Okay, everybody, I think we're going to get started. Really appreciate you joining us today for our webinar on analytics in the real world. We're here today to try to get out of the theoretical a little bit and really discuss with you how data can be used by behavioral health organizations to drive better decision making. Just quick logistics before we get started. Everyone is going to be muted, but there's a question and answer area in the webinar window that'll allow you to ask questions. So feel free as we're working through the webinar to send in any questions that you have, and we'll try to answer them either during or at the end of the webinar. We're also going to send along a couple of poll questions as we go, and we're really interested in your feedback and your thoughts on those areas. A quick introduction to the presenters today. My name is Matt Hoffman, and I'm here with my colleague Chris Akerley. We're two of the managing partners with Afia. Afia is a healthcare consulting company out of Ann Arbor, Michigan that optimizes the clinical, financial, and administrative functions of behavioral health organizations through the use of technology. We're really excited to be talking about analytics today and how to use data to drive decisions, because over the past decade, we've worked with organizations, a lot like yours, across the country to help create solid foundations, helping to select and implement electronic health records, finance systems, HRIS systems, all of those different electronic systems that help to capture data. And it's exciting now to really talk about how to take that information, take that data, all the work that you've done for so many years, and then be able to use that to help drive outcomes, decrease costs across your organization. So for the agenda for today, we're really going to look at three things. The first is why being data-driven is so elusive, what makes that so difficult. Concept that we like to talk about knowing versus feeling when you're making decisions as an organization, and then really trying to find your action. Discuss some ways that you can apply some concepts within analytics, within looking at data, to help drive decision-making in your organizations and hopefully give you some things that you can take out of this conversation as next steps. And the two biggest learning objectives that we're hoping you'll take out of this, the first is to understand data's role in creating a call to action for change. And the second one is identifying at least one new way you can analyze your own data to promote change in your organization. Before we jump into everything, really wanted to start with a case study. So that way we can discuss just on a high level what this looks like. What does analytics in the real world look like? Because obviously we wanted to drive change, drive outcomes. So in this case, the challenge that was brought up was a Michigan community mental health organization that we were working with was experiencing what they thought were unnecessary hospitalizations, and really wanted to try to do something about it. Obviously, this is a large nationwide initiative to try to decrease hospitalizations because they're not only costly for the system, for providers of care, but also many times clinically inappropriate. So as much as possible, getting people the care and the environment where they need it. So the approach for this was, in taking on this initiative, obviously starting with the data. Once the Afia consultant was able to get into the data, it was starting to look for trends, starting to look for any consistencies or patterns in the information. And one of the things that she noticed was that there was a common admission time between 3 and 5 p.m. And from there, it was basically led to discussions with the organization of what could be happening with policies, procedures, with workflows to drive those admission times during that time of the day. And what was found was that due to scheduling, calls after 3 p.m. were sent to a hospital-based team. And that hospital-based team had a 98% admit rate. So with that, it was basically working then with the organization to try to change the scheduling, try to make workflow changes so that the teams were available during those high volume times. And by pushing people's schedules back, by making sure that people had open schedules and open times to allow for those conversations, there was a large cost savings. But even beyond the cost savings, over a 6-month period, there were 36 fewer adults and 16 fewer kids that experienced these unnecessary hospitalizations. Obviously, that's a huge win. And I think for many of your organizations, these are the types of things that we're hoping data can help drive, is creating short-term large wins, again, both in the outcomes, the type of care, and this is really what we can use data to do. Before we get in, we wanted to set the stage a little bit and discuss this concept of why being data-driven is so elusive. One of the most telling statistics that I've seen came from Gartner, and that's this concept that 60% of analytics projects will fail to go beyond piloting and experimentation. The graph that you're looking at is something that Gartner created called the hype cycle, and what it shows is adoption over time with systems. And this is something that's really common that we see with organizations, especially when it comes to things like data analytics and business intelligence tools. And really what this shows is that there's this initial level of excitement. So an organization gets an analytics tool and it has pretty dashboards. And it has these nice pretty dashboards with information. And so people get really excited and start logging in and start looking at the information. And every day they're looking at it and they're seeing the changes over time. But just as quickly as they get excited about it, they also realize that that data that they have isn't driving any change. There's nothing that's changing within the organization from that. And because of that, just as quickly as you had this adoption, that goes away. People stop using the systems, they stop paying attention. It becomes something where you hope over time you can have some initiatives that will lead to increased engagement. But most of the time you've lost that span, that engagement from staff, because they just haven't seen any outcomes from the system. So this is why, one of the reasons, the reality is it's just not easy to turn data into action. So we see organizations that tend to fall into 4 different levels of data adoption. The first is organizations who just don't have data. And so these are places that are relying on anecdotal evidence. So it's that concept of it feels like, which we'll talk about a little later in the webinar. The second is organizations that have data, but they don't have benchmarks. So it becomes really difficult to take action because they don't know if what they have is good or bad. So they have their productivity percentages, but is that good compared to national averages? And then it's breaking that down per program, because obviously programs will be different. And if you think about that across all the different areas, you have benchmarks that you really need to understand to be able to make decisions. Then there are organizations who have data, have benchmarks, but just don't know what to do. So a lot of these organizations either don't have the right approaches in place, don't have the right processes, work groups to be able to really take advantage of the data and the information that they have. Or it could be a cultural issue. And this is something that we see very frequently, where organizations just aren't set up with the proper culture to be able to use data to make decisions. They've been using that sort of anecdotal approach for so many years that that's become the norm. And so to really change the structure of an organization or change the culture of an organization to use data as the consistent benchmark for decisions becomes difficult. And then the final, sort of the 4th level of data adoption that we see with a lot of places is people that do have the data, they have benchmarks, they know what to do, but they're just not doing it. In many cases for these organizations, it's really that they just need a person pushing it, whether it's a coach, a project manager, somebody who is really paying attention to the initiatives, making sure that things are constantly moving forward, that there's action being taken, and that when things need to change, that somebody's paying attention to it. So those are sort of the 4 of the major levels that we see with places that we're working with. And this brings us to the first poll that we wanted to do. We wanted to get a sense from your perspective of which one of these areas you feel like your organization falls into. So you should have a poll up on your screen now. Be interested to see your thoughts. We'll give you about 30 seconds for people to answer, and then we can jump in. That's great. We got the results here, and there's actually some. It's interesting. There are no responses of people that don't have data, which is not surprising considering all the initiatives with electronic health records. But there's a tie between organizations that have data but don't have benchmarks, and those that have them all but just aren't doing anything. So, which again, these are really consistent areas where we see people that they sort of live with their organizations. And the nice thing about it is just knowing where you're starting from, obviously, it's easier to be able to put together plans of what you'll need. And as we go through the webinar today, we'll have some good thoughts on how you can close some of these pieces out. So along with the difficulty of turning data into action, another reason that becoming data-driven can be really elusive is because organizations frequently approach the concept of data analytics using data to drive decisions as a technology project. The reality is these types of projects are change management efforts, significant organizational change efforts as much as they are technology projects. So when we look at these things, we talk about the need to build performance through 5 different competencies. From our experience working through large-scale projects with organizations over the last decade, we found that there are 5 big concepts that jump out that need to be considered anytime you're working on large-scale change efforts. And if you're able to take, basically work through all of these during change efforts, you'll be successful. So the first one with this is governance. And this is really the concept of creating a vision, creating a strategic direction that people can drive from. So it's making sure that organizational leadership creates a vision and that aligns with the strategic goals of the organization. The second is people. It's making sure that the employees and staff have the right skills, that the staffing levels are appropriate when you're looking through. And then the big third one, which we already talked about a little bit, is that concept of organizational culture. Does the organizational culture actually encourage the desired behavior that you're looking to get to? For processes, this is looking at the consistency of our staff using intended processes. Are there incentives in place to have them do so? These are things, again, with electronic health records are an area where this becomes very common because there are a lot of difficulties sometimes in being able to define the most efficient processes for all the different types of staff and programs. But you get into this in any major change effort where you have to make sure to baseline and define what processes need to be in place and then drive incentive there to have people follow them. For technology, it's making sure that all the needed tools and equipment are in place and that all the staff have that technology. One of the biggest things with this is it's making sure that there's the alignment of the business needs, what people actually need technology do to the technology itself, and making sure that that's efficient for people. And then finally, execution. And this is making sure that when you go from planning to actually implementing or operationalizing, that the management, planning, technology, everything is in place so that you can actually execute on that vision. You can execute on the planning components of it. And when you think through this, without all 5 of these, you really run into trouble, run into problems. And I'm sure these are very common things that you'll see. So with all 5 in place, you'll drive to change, sort of that lasting change that you look for. But when you don't have governance in place, people will be confused. They won't understand exactly what they're trying to accomplish. What is the end outcome you're looking for, and what's the purpose? Without people, you'll get resistance. People can be obviously a barrier if not engaged from the start of projects, especially when it's really trying to change culture and trying to move people from one way of thinking to another. If they're not engaged up front, then you'll likely run into resistance, which will cause problems in projects. Without the right processes in place, you'll get sporadic change. Some things may change well, others won't, because either the processes aren't well defined or they're just not consistent. And then technology, I think we're all very accustomed to technology. It can be very frustrating at times when it's not supporting you well. So without technology, there's that anxiety and frustration that comes. And then without execution, it's this concept of false starts. And a lot of times I equate this with people of the concept of running on a treadmill, because you feel like you're making all this progress and you're knocking things off the list and potentially checking things off, but you're just not accomplishing anything. And the final reason, those are obviously the concept of becoming data-driven and planning for all 5 competencies is so important. But even when you plan for those, it's very difficult to find the type of talent that you need to be able to drive these projects forward. So this chart shows you for 2018 the gap in qualified data analysts, what's available and what's needed. Obviously, you see there's a significant gap here. But really have to keep in mind as well that it's not just data analysts. When we talk about these projects and the fact that it's not just a technology project, we're talking about project managers, process improvement experts, subject matter experts. It's that group of people that you need to drive projects forward and provide the level of expertise and information to be successful. And it's very difficult to find those people. And if you have them, there are many times where they're super busy because they're staffed on multiple other projects because of that level of competency or expertise. So those reasons and some of those reasons of why it's difficult today is why we're here to teach you hopefully some basic tools that will help you to become more data-driven.
Yeah, and so this is Chris. First thing we wanted to talk about is, before we get into actual techniques for analyzing data, we want to talk a little bit about the mindset around data, and just the difference it makes when the group of people you're working with have concepts of, well, maybe this is an issue, versus being able to prove that there's an issue using the data. And we call that knowing versus feeling, as Matt mentioned earlier. And so this concept of knowing versus feeling, it comes from our main clinical expert, Kathy Detling. I'm pretty sure Kathy's on the line, so I hope I get this right and I don't have to hear about it later if I offended her. But so Kathy is a social worker. Her husband is an accountant. And so as she relates it, they have different ways of seeing things sometimes. And at one point before they were married, Kathy said something about how it feels like she had enough money in her checkbook to cover, some purchase that she was trying to make. And I guess her husband was just appalled at that idea. Just the concept of there's just certain things in this world where it feels like doesn't quite work, and you need to know whether there's enough money in your account to write that check. So if you take this and you expand it at an organizational level, it can be really hard to drive action based on it feels like. If it feels like you have money in your checkbook, you can just keep writing checks no matter how much money is in that checkbook. At an organizational level, if it feels like your productivity is low, maybe some other people feel like it's just fine and they don't see the need for change. So it's really hard to motivate people when it just feels like. And this is a really important concept for analytics, because if your culture at your organization is a feels like culture, your colleagues might not see the value in data. And then you go to analyze the data, and that can be somewhat fruitless, because it's great to know things about the data, but if nobody's actually going to take action on it, then it's not all that rewarding to be doing data analysis. So your whole organization needs to prioritize and value this idea of knowing versus feeling to have a successful data culture. But in our experience talking with behavioral health organizations, this feels like culture is essentially where organizations are today in a lot of cases. And given the expertise of a behavioral health organization, the idea that there's a lot of talk about how something feels, it probably shouldn't be much of a surprise. But what we've assembled here are just a few examples around revenue, documentation, timeliness, and service mix and performance to just show kind of the difference of what a feels like conversation is versus an I know conversation. So in this first example, talking about a scenario where it feels like revenue is going down, and maybe the organization will do something about that, but maybe it won't. But if you have some data to show what the revenue looks like, and this is probably a chart that's not unlike data that you've seen in your own organization. So this is just monthly revenue for a certain program. Each bar represents the amount of revenue in that month over a certain time frame. But one of the things that's happening here is the numbers kind of go up and down over time, so you can't really see what the pattern is necessarily. But by doing just a simple linear regression on this data, adding a trend line, it shows you that now you can visually see in blue that the revenue is going down. And you can also project out for the next few months, which is what this shows, what direction is it heading. So now that you've got a graph that shows that it doesn't just feel like revenue is going down, revenue is going down. This can be your call to action to talk about it. And so it doesn't tell you what to do, and then we'll talk a little bit more about how to find out what to do in the next section, but it really just starts opening the conversation and driving that call to action. Maybe you need to review your productivity. Maybe you need to do a revenue cycle assessment to look for revenue leakage. Like, why is revenue going down? Or maybe you just know that it's going down because maybe the state cut rates for you or whatever it might be. So, but it at least gives you a place to start the conversation. Another example is about lag time and entering in notes. So, this conversation starts with, it feels like notes are being entered the same day. Everyone says that they're entering notes as quickly as they can, and nobody has said it's an issue yet, so no action. Once you start analyzing the data, you start seeing some reality in the data. The statistics can show you a different story. So just showing a few basic statistics on this, instead of all of the notes being entered in same day, the average number of days for entering a service is 7.5 days. Averages can be a little tricky because if there's some really big number on one end of it, it might drag the number further away and not be a real representation of the data. So you also look at things like the median, what's the max, and so you see that maybe the median shows it's maybe not quite as bad as 7.5 days. But you can also then dig in and just look at the distribution. And so what this chart shows you is, for each of the different number of days of lag time, 0 days, it was put in the same day, it was put in a day later, it was put in 2 days later, 3 days later, 4 days later, so on and so forth, shows you what that looks like. And so now you can see that it's not the case that most services are going in on the same day. In fact, only 26% are going in on the same day, and only 67% go in within a week. So all of those other, depending on what your criteria is, whether it's 24 hours, 48 hours, or the two main ones that we've seen, every other grouping here is an opportunity for improvement. And again, it doesn't tell you what the problem is. It could be that there are staff that are overwhelmed. It could be that staff need to be trained on concurrent documentation. It could be that you need an EHR optimization review because the system is not supporting your staff well. But that's where you can dig in deeper on this. But just seeing this could be startling to organizations where it feels like all the services are being put on the same day. Here's another one. It feels like our consumers are all high intensity. So you've got your service mix designed around high intensity. Policies and procedures are really best suited for folks with high intensity. But what if that's not really the whole story in your data? What we have here is their locus scores, and the bars represent the number of clients served at this agency with that certain score. And if you're not familiar with the locus, I'm assuming most folks on the line probably are, but it's a tool for evaluating the level of care. It has certain domains like risk of harm, functional status, comorbidity. And by the time you're done scoring, the tool gives some guidance on potential level of care for that person. And so I know that there's probably varying perspectives on the locus and its value, but there are many states that require this as part of state reporting. So this is one of those things where if you have to do it anyway, you might as well get some value out of it. And so for this organization, if the perspective is that most of the clients are high intensity, the data is showing that in fact it's actually about 50-50. So the clients this way, there's 51% of the clients are high intensity or above, and then but 49% of clients are actually some form of lower intensity or in recovery. So, with this data, an executive team could really be asking themselves, are we appropriately adapting for this? Are we giving the same clinical pathways to the people with high intensity and low intensity? If the perspective is that everybody's high intensity, then you may just be giving everybody the same clinical pathways. But maybe you're over serving the folks who are on the low intensity and you're underserving the folks who are high intensity. And especially as we head to value-based care, that idea that you're providing just the right amount of service, it will be really important. And one of the things that's interesting here, this is sort of could be a call to action if this doesn't match your perspective on it. And then you can dig in on this data to figure out, well, what kinds of services are folks getting, in the recovery area or in the low intensity. And in this particular data set, some of those folks are even have room and board where you wouldn't necessarily expect them to be, having residential kinds of services, given the cost associated with that if somebody has a lower locus score. Here's an example. It's a little more technical in nature. It feels like EHR reports are running slow. This is a situation where it's kind of like going to the mechanic. Every time this customer tried to show this problem to the EHR vendor, it just ran fine. I swear it makes this noise every time I pull it out of the driveway, but it just didn't when we were showing it to the vendor. So as a result of that, the idea that the reports were moving slow really didn't get fixed, and it went on for months. So the approach that was taken was there was a benchmark report that was just run every few minutes. And the number of minutes it took to run that report were logged in this graph. And you can see, so these are actually minutes. So you can see the benchmark is around an hour, it's about a minute and 40 seconds. So that's how long it took to take the report when it's down here in these little ones. But you can see these big jumps where it's over 10 minutes, it jumps up to probably 55 minutes, some around 80 minutes. And actually showing this data that, in fact, if you consistently run reports, that they do run extremely slow at certain times of the day or just in general, led the vendor to then take it more seriously and say, I can't remember all of the different things that were done to solve this. There were maybe 3 or 4 different steps that were taken. And each time they would try a step, it would improve performance a little bit, but not completely, because they could use the graph to prove that the performance hasn't improved and keep iterating on that until performance improved. And it took about 2 weeks, and then this problem went away, and the graph now just looks like a flat line. So that was a big win for data. So I just want to do one more poll question as we ran through that, and just get a sense from you all. How do you think your organization makes decisions? Do you mostly make it based on feeling or based on knowing? So I've opened that up now and give a couple of seconds to get results. All right, so I'm gonna wrap up the polling there. It was kind of a surprise. I've got data now. I felt like everybody was gonna say feels like, but instead, most folks, 77% of folks said that they make decisions based on knowing today. So that's great. And so really what I was hoping to do with that section was to convince you of the value of knowing versus feeling so that we could move into, well, what do you do to dig in? It seems like you've been convinced before. So hopefully that'll be a useful tool, though, for all of your non-believers out there, that you maybe use some of those examples to convince them why knowing is so important. So then, in terms of digging into the data, it's really a science and an art. There's no single way to analyze the data. It's about trying to find the truth or events in the data. And so, you don't want to come at this as that sort of proverbial person with a hammer where everything looks like a nail. You want to be able to have the right approach for the job. So as we go through this section, we're going to talk about 6 different techniques. There's definitely more, but we just thought, sort of an introduction to this, and let's not overwhelm it, about how to dig into the data. And so just a quick summary of those are using benchmarks where possible, looking at the shape of your data, looking for outliers and making them your friends, looking at the same data from multiple perspectives, using individual cases to find a pattern, and breaking the data into actionable groups. We've already talked about the value of benchmarks just in terms of knowing whether data is good or bad, but when you start digging into the data, it's It's useful for benchmarks to help you know to activate and really start moving because your data is not in where you want it to be, but it's also helpful knowing where to stop. So to give you an example, you may run some data and find out that your productivity is at 16%. And that's great if you expected it to be 10%. But it's not great if you find out from a benchmark that it should be 60%. And so you'll want to start digging into that and finding out why is it that way. But it also might be time to move on and stop digging after you've gotten to 60%. I'm a self-professed data nerd, and so I could just dig in on data all day long. But the world is full of things that we could be looking into, and we need to know when to stop as well. So having benchmarks can be helpful on both sides of that for turning it on to go after it and be activated for change, but then also turning it off because you've gotten that area in a good place. And it doesn't have to be that you find a national benchmark and that's all you're shooting for. You have your own goals, but set goals in those areas so that you know when enough is enough in doing analysis. Just looking at the shape of data can be really helpful. So this is data, back to the hospitalization scenario that Matt described. This is similar kind of data. It's the number of requests per hour at an organization. And if I didn't know anything else about this data, I can just quickly step back from it at 30,000 feet and have some findings, right? We know just by looking at this, there's a single peak, and assuming this is in chronological order, which it happens to be, but it doesn't have to be. There's a single peak. It's about midday, and so just knowing that is one thing. It's not like you have to staff for two different high intensity request periods. There's a single period. There's clearly a lull period at some point where there's fewer requests, but at the same time, requests do come in 24 hours a day. It's not like you can say, well, we can just stop taking requests at the middle of the night or something like that because there are 24 hours worth of data. And so I'm just going to toss on these are the times. So you can see that similar to the example that we gave, it's around 2 to 4 o'clock is when the peak is. And then you can go digging in from there. But just looking at the overall shape of data, it can really just help you start figuring out where to dig in. Another technique is just to visualize your data in a way that you can see the outliers. So this is data, back to our the lag time example of entering services. This is data showing for the number of clients served, how many days does it take on average for this program, each dot is a program, to enter in their services. And you can see right away that there's this group over here that on average it takes 35 days to enter in a service, which is not good. And so, talking to that group could be a good place to start. That's some low-hanging fruit. But at the same time, there's also this group over here that's doing great. They have almost no lag time putting in their notes. They're serving a reasonable number of clients, more than some of these other groups that are taking more time. So you can go to this group to try to make quick action and change, but don't forget about this group that's doing a great job and find out what are they doing that is that's leading to those good outcomes. And maybe you can reproduce some of those throughout the organization. And then of course you can start marching down. You can just take this visual and say, who's this group? They're at 15 days. Who's this group? They're at maybe 13 days, and so on and so forth, and just keep working down. And these ones here in the middle might be tougher nuts to crack. This is a really important one about just never trusting a single perspective on the data. I think this is a trap that many organizations can fall into because it's so hard to create a report. And so, you finally get your requirements together. You go through a week of asking the analyst to provide it a certain way. You iterate on it, and you finally got your report. And now you got your data, and you kind of just love to see it in a different way, but you don't feel like going through another week of work. So, but it's really important. So this is an example. This is that same timeliness data shown as a bar graph. And you can see that same program that was off on the far right also looks like an outlier here. This is their number of days on average to enter a service. These are programs. You can see they're almost double the next program. So that's one way to look at the data. We saw that in another place. But if we visualize it a little differently, this program, drawn as a chart like this, now this is the number of basically staff who can sign off on notes. So, they have one in this example, and some of them have over 100. And so they have one person who can sign off on notes, and they're serving, I think it's 700, but on the graph, it looks like it's about 1,000. So there's about 700 clients over this time period that they're seeing. So you look at this graph and you say, oh, that program is not performing. You look at this graph and you say, wow, that program's performing way better than all of these programs, because they're just being more efficient in terms of the number of staff that they're seeing, or the number of clients that they're seeing. So, and again, this doesn't necessarily tell you the answer, but it could help you. Your immediate reaction might be, well, those people aren't doing their jobs. They need to get their notes in faster. Why aren't they compliant? But when you see the data a different way, you see like, you have some sympathy maybe for, they're really doing a great job with only one person who can sign off on notes and serving 750 clients. And so maybe they need some more support. Maybe it's a staffing change that needs to happen. Maybe you can work with them on concurrent documentation and processes. Maybe the staff person, the supervisor, is seeing clients and trying to be a supervisor, and they should be pulled out of that role. You can start digging in once you have a more well-rounded understanding of the data. And at this point, we've seen that same data in 3 different ways, and we're going to see it in a couple of other different ways as we go. But every different perspective gives you a little bit more insight into what's happening, not just in your data, but in the real world. So this, we went from understanding in the real world, 35-day average, to understanding in the real world, they only have one person who can sign off on notes. This one's, we often hear, you can't see the forest for the trees. This one's sort of the inverse of that. Like, go down and see what the trees look like so you can help understand the forest. And so what you can do there is you drill down to a program level, and then just see at the program level, is there some sort of pattern? Inside of this program, are notes being entered in consistently late because it's this sort of client or this kind of service or this sort of thing? And if the pattern is obvious, then great, go make some changes. You can address that and tackle it. But if the pattern isn't obvious, maybe drill down to an individual case. Just look at one provider or one consumer and see what's happening there. So at that point, maybe you can get some theories as to what's happening. So somewhat, not client data, but actually provider data for meaningful use. We had an analyst who was going through and looking at the data, trying to figure out which providers are meeting meaningful use. There's all these criteria and percentages they have to meet. And he was able to dig in, and there was a pattern where the educational resources weren't being filled in, and he was able to drill down into individual prescribers, find out that this prescriber had a certain issue, knew that for that prescriber they were working in a rural environment and didn't have quite the same support staff, and then was able to roll that up into a bigger theory in order to start solving that for that person in the real world. So that, in that case, that individual case did give him a theory. So he was able to go back to the higher level and see if his theory held, and it did. So then he was able to go make some change. But I think an important lesson in this is it's not just the successful one. So even if his theory ended up being false and he wasn't able to make the change from that, it's still a great thing. He learned something from it, and he can use it in the next iteration. We'll talk a little bit about the iterative nature of all this in a couple of slides, but I think that's really important to still celebrate your failures because it taught you something. And then if that case doesn't prove it, that usually works, but maybe getting a second set of eyes on the data, trying one of the other techniques could help. That's just sort of the end of the road for this approach. And then eating the elephant one bite at a time is important. So if you've got a big set of data and you're trying to figure out how do I actually make change with the data, it's really critical to be able to drill down into the data into separate meaningful groups. And again, without asking for new reports every time. So, and again, we're looking at this same timeliness data that we've looked at a few times. We're going to look at it a couple of different ways. So we look at it by team. So this is one we've already seen where this unit program is almost twice as much as the next one. But maybe we also want to look at this by person. So here's a staff person who, if you thought 35 days was was tough. This is almost 60 days. So what's happening with that person? And there's a few people there. So maybe instead of going to that unit, you could go to these people and sort of tackle it that way. Or maybe instead of going by person, you go by supervisor. So this supervisor, the staff that they supervise on average have a lag time of around 30 some days. And so I think it really depends on in your organization, how do you get change? Is it best for you as the analyst to go right to the team? Is it best to go right to the person who's having the issue? Is it best to talk to the supervisors? That's an individualized decision and approach, but the idea that you break it down that way and really thinking about who am I going to ask to change this? That should be your thought about how you want to isolate the data and drill down into it and look at it so that you can take that data to that group's attention that can make the change. So those are the 6 techniques. But just some words of wisdom around this is not to expect to find all the answers at once. Really an iterative approach to this works best. There's other approaches to this, but we've got the plan, do, check, act cycle up here where, the first thing to do is just look for some root causes of the issues that you're working on, use the data analytics in order to do that analysis. Go try some things, attempt some interventions and see it, measure it with data and see if it actually changes the problem. Check, you want to make sure that you do the know. It's not just know it up front, but know whether or not the thing you're changing is making any difference. You just don't want to say, it feels like we're improving recidivism, or it feels like lag time is going down. You want to know again. And then once you know, you can take the action. You could roll it out to the entire organization, or again, you might know that it's a failure, and that's okay. You want to find those things too, and it's just the important thing is to do it fast and to learn from those experiences. Also remember that this is not just technology. Matt mentioned this at the start of the webinar. And so without these 3 areas, without knowing those best practices, knowing how to actually do some things in the right way, without having some key data analysis skills to dig into the data and use some of these techniques that we looked at. And then adoption is really important as well, where this is not often a if you build it, they will come sort of situation. You need to be monitoring whether people are using the tools, whether any change is happening, and continuously following up with folks. And as you do that, the intersection of those 3 things is where you can get some of that change. And the last thing I'll say before wrapping up is just with great power comes great responsibility. So, when you find data, the key is to use it to start a conversation. You don't want to use it to hit people over the head with it. I showed that graph of the staff who had maybe 60 days of lag time. You don't want to go charging into that staff's office and say like, aha, you're the problem, because that will, you don't want people cringing every time you come with data. You want people open and accepting to it, and you want to build a trusting environment, and that's not always easy. And then you can't just rely on the data alone, because like I said, maybe you do have that one viewpoint of the data that makes it look like the team's just being irresponsible and not putting in notes, but you haven't quite gotten that other angle of the data that shows you, but they're working really hard because they only have one person signing off on the notes. So you really need that human understanding still. You need somebody who can put the data into context for you and not just work off the data alone. Okay, and with that, I think we're going to open it up for questions.
Perfect. And one of the questions that we had was if there are any tools that are needed as you're going through processes like this. I'm guessing that's in regards to technology. And I think an important thought with that is in some of the cases you really don't. It's something where as long as you can get extracts of the data, the information, and you use Excel, you can do a lot of work in trying to see trends and trying to understand the information. The biggest piece there to understand is sort of the time it takes to do that. So with some of the analytics tools, with some of the business intelligence tools that are out there today, it allows you to slice and dice information so much faster. So those different views that Chris was showing as he showed graphs and being able to sort of look at things in different perspectives, being able to filter different ways, being able to get different types of views. Those are the things that an analytics platform allows you to do. And that is obviously extremely helpful because it makes you, it'll create a path for you to be much faster and being able to analyze and understand information. Instead of having to either use the standard reports, which as you mentioned, you might have to have something created and then request updates, wait a week for updates, see it, request more updates, wait another week. Next thing you know, you're a month down the road and you still don't have the information you need. So while those tools aren't necessary, they really are the things that will make you much more efficient in the processes of using data to drive decisions. Any other questions from the group before we close things out here? Feel free to put them in the Q&A portion of the webinar.
Okay, well, we're not seeing any other questions. Hopefully nobody's frantically trying to find where the Q&A button is and can't find it. If you are, Matt's email address is here on the screen. Feel free to send him a message and we can answer your question. And with that, I think we're at a wrap point. So we really appreciate everybody taking the time to listen in, and we hope it was helpful. We hope we hit our couple of learning objectives. And we'll talk to you all soon. Thank you.